September is Prostate Cancer Awareness Month, and in our communities, it is even more critical to bring attention to this ailment, as prostate cancer is 250% more deadly for African Americans and 40% more likely for Hispanics. It's a serious problem in Boston, and Admitech is a local nonprofit working to spread prostate cancer research and awareness in the underserved communities. It's holding events and doing outreach in September to make sure that men know their risk. Now, to tell us more on these events is Admitech CEO Dr. Shtern and Juan Cofield, who is president of the New England Area Conference of the NAACP, who has been collaborating on healthcare disparity issues and is co-hosting an event for Prostate Cancer Awareness Month. Thank you for coming in to Open Update. Welcome.
Thank you for the opportunity.
Dr. Shtern, let me start with you. How common is prostate cancer in Massachusetts? You know, I was talking about the health care disparity here, major disparity, and why are some people more likely to get it than others?
Prostate cancer actually the most common, the single most common major cancer in Massachusetts, as it is in the nation. It strikes as many as 1 in 7 men. It's a major epidemic, and unfortunately, it's a major unrecognized epidemic. Prostate cancer is also the greatest healthcare disparity in adult population between black and white populations. You already mentioned the disparity in mortality. This is the most reliable measurement we have for evaluating healthcare disparities. Unfortunately, we have no answers why African American men or black, including Hispanic men, are so disproportionately dying of prostate cancer today. However, we work with major nonprofit local organizations, including New England Area Conference of NAACP.
Yes,
I'm so sorry.
That's right.
Including Massachusetts Prostate Cancer Coalition, American Cancer Society, and other organizations, in order to create Massachusetts model of national leadership in ending prostate cancer as a healthcare disparity.
Now, Juan Cofield, I take it this is why groups like the NAACP really work and need to combat this disparity.
That's exactly right. Particularly with prostate cancer, there are many diseases in which there is a disparity between blacks and the more general population, but prostate cancer really stands out. One of the things that the National Board of the NAACP decided in setting a strategic plan several years ago was that it wanted to more narrowly focus its resources on game changers, and healthcare delivery, awareness, and ending the disparity is one of those 5. Okay. It is a major game changer for the NAACP.
Dr. Shtern, talk to me about some of the events you've got planned for Prostate Cancer Awareness Month in September here.
Our goal is to bring the world-leading knowledge from Massachusetts hospitals to the most underserved and vulnerable populations in the state. It's a part of a statewide program in prostate cancer awareness and education. And within the context of this goal, on September 20th, we will hold an event at the Lion de Judah Congregation for Hispanic population that has, as you pointed out, 40% higher mortality than state average right here in Boston, in Suffolk County, where we have some of the best world's hospitals. So we will hold this event in order to combat this kind of disparity in Hispanic population.
Juan, what message are you trying to get out to the men of color here in the Boston area?
It's particularly important because of the disparities, and the disparities are enormous, as Dr. Shtern said earlier. Black men are 2.5 times, 250% have a greater mortality rate than the general population. That's something that we can effect by getting the word out, having men diagnosed early and then treated early when the diagnosis suggests such is needed.
Okay, now, Dr. Shtern, what should men do if they have any questions or if they think they're at high risk? What's maybe the first step they should take?
The first thing that men need to know is the critical importance of early detection of prostate cancer. With early detection, every man has a chance to survive prostate cancer. With late diagnosis, every man is at risk of losing his life to prostate cancer. Currently, we have blood test, which is called PSA, that for particularly black men is a very simple choice. Will they have blood test or will they risk dying of prostate cancer?
Juan, I guess what would you tell a younger version of yourself, seeing you yourself are a prostate cancer survivor?
Early diagnosis. I will repeat what Dr. Shtern said. Early diagnosis. I was diagnosed early. I got treated early. The treatment, which was roughly 12 years ago, we think it's been very effective. There are no signs of prostate cancer, and that will likely happen over and over again when people are diagnosed and treated early.
Okay, just very quickly, Dr. Shtern, just show our viewers just a way to get more information. We've got some information up on the screen. We want to put anyone who wants more information. Where can they get it?
Absolutely. They're welcome to visit our website, admitech.org. We will have...
And you've also got the Prostate Cancer Hall, September 26th. These are some of the events, prostate cancer workshop.
Jointly with NAACP, we actually will have a prostate cancer awareness event in Bedford.
Okay, and we'll have to leave it right there. Dr. Shtern and Juan Cofield, thanks for coming in. And, get out there and save some lives and Prostate Cancer Awareness Month. Thank you.
Thank you very much.
Thank you.
Okay, coming up next, a verse that has been promoting racial and ethnic harmony for 30 years now. The details right here on Urban Update. We'll be right back.